Hello and welcome once again to Moorgate Andrology. Now in today's video we're going to talk about penis enlargement surgery before and after. What is possible to achieve from a penis enlargement surgery? So at Moorgate Andrology, about 85–90% of patients who come for penis enlargement surgery will have the penis lengthened and thickened at the same time. But it's quite possible, of course, if you just want the penis lengthened or thickened, that's fine too. So let's have a look at the before and after possibilities. So the first thing we want to mention is that the vast majority of men that come for penis enlargement before the surgery, they have statistically a normal size penis. But they just want it bigger, it makes them feel more confident, or they just want it for purely aesthetic reasons. But really, apart from a micro penis, which is something completely different, the results of penis enlargement surgery are quite predictable. So let's talk first about the length. So the medical term for the procedure to lengthen a penis is called ligamentosis surgery. Ligamentosis surgery. And this involves the division of a ligament called the suspensory ligament. And this ligament is freed from its attachments to the pubic bone by the urologist. And this action slides the penis forward and makes it hang to a lower position. And this what gives length gain. Now we know in 95% of men, this extra length gain is 1 to 2 inches more. So 95% will get between 1 to 2 inches more, and 5% of patients will either get a bit less than 1 inch or a little bit more than 2 inches. For nearly all, it's somewhere between 1 and 2 inches. Now, an important point to mention here is that this extra length of the penis is only visible in the flaccid length, not the erect length. The erect length more or less remains the same. So who has ligamentosis surgery? Well, a lot of guys come in and they say, well, when my penis is erect, it doesn't look too bad. But when my penis is flaccid, it looks really small. So this inhibits activities like gym, sport, where they're involved in changing with other men perhaps, and they just don't have that confidence to do so. So ligamentosis surgery could be a good solution for that. Now, 6 weeks after the surgery, when everything is settled down, we start to work on the erect length of the penis. And this is done with a traction device that the patient fits onto the penis under the trousers. And it puts the penis in a slight traction, not painfully, but you will feel a little pull on the penis when you put it on. And this traction device can increase the erect length of the penis by up to 1 inch in the following year with consistent use. The idea is that you put it on for 1 to 2 hours each day over the course of 1 year. Look, there'll be days when you forget, you're going out or on holiday perhaps, and that's fine. But the idea is consistent use over a period of 1 year. So those are the predictive results, the before and after of penile lengthening surgery, otherwise known as ligamentosis surgery. Now, the second part of the process is to make the penis thicker. And we do this with a fat transfer, which is still the gold standard way of making the penis thicker. Now, this part of the surgery is quite different insofar as where the length of the penis is only made longer in the flaccid state. In the girth of the procedure, there is significant before and after because we can make the penis thicker both in the flaccid and in the erect state. And this is done with a fat transfer. So fat is taken from your belly or your inner thighs. We take it from there because this is where the best quality fat is, particularly fat on the inner thighs. And then this fat is purified. We take out blood and oil and dead cells from the fat first, and then it's injected into the shaft to thicken it. Now, typically, the girth increases are around 1 inch, or at least 20% more than you have now. And this gives a pretty significant increase in penis girth. Again, both flaccid and erect. Now, the important thing to remember is the urologist will put into your penis the maximum amount of fat that your penis will safely take. This is because we know that even though we purify the fat before it's injected into the penis, about 30 up to 50% of the fat will absorb in the first 8 weeks. This is a natural physiological process that you can't prevent. But even allowing for this for this absorption rate, you still have the kind of girth gains of around 1 inch. Now, we see in a number of cases that guys don't seem to absorb much fat at all. It doesn't happen to every patient, but we do see it. And in those cases where guys retain most of the fat, then the girth gains are pretty significant. 2 inches perhaps of girth increase. So this makes a significant difference to the penis girth. So the before and after at the end of a combined lengthening and thickening surgery is a penis which is 1 to 2 inches longer in the flaccid length and at least 1 inch thicker, more or less, in the flaccid and the erect girth. Well, I hope that's given you some insight into the before and after possibilities from penis enlargement surgery. I hope you've liked this video. If you have, please do click the like button. And if you'd like to see more videos from Moorgate Andrology, please subscribe. But that's all from me today. I look forward to seeing you back here at Moorgate Andrology very soon. But until then, from me, it's bye for now. Bye-bye.